looking to connect a region of over 600 cultural bridges between our lands.
Good evening, I'm Alma Angeles, and you're watching ASEAN in Focus on tonight's headlines. The Department of Health said China's health situation in a particular area shouldn't deter the president or anyone from performing his duties. Infections have surged across China following the unwinding of its ultra-strict zero-COVID policy. The death toll from floods in the Philippines has risen to 25, with storms expected to dump more rain over the hardest-hit southern and central regions. The Department of Health has recommended an extension of the COVID-19 state of calamity in the country. And underneath the calm turquoise waters of eastern Thailand, a rapidly spreading disease is killing corals over vast stretches of the seafloor, and scientists fear it may be getting worse because of climate change. First in our news, the Department of Health said China's health situation in a particular area shouldn't deter the president or anyone from performing his duties. Dr. Rosario Vergere said they have already apprised the president and his staff of the COVID situation in the Philippines and in other countries. Let's listen in.
Yung travel ng ating presidente going to China, hindi ho kami ang dapat siguro sumagot, no, if he's pushing through or not. Although we apprise the president and his staff about the situation, not just in the Philippines, but also in other countries. Kailangan maintindihan din natin, we are already currently living with the virus. So, yung pagpunta, for example, sa isang lugar na isang tao dahil mataas ang virus detection should not hamper us from doing our work. Ang mga bisita po ng ating presidente sa iba't ibang bansa ay importante para sa ating ekonomiya. And if the precautions are there, he is fully vaccinated and complying to minimum public health standards like wearing of a mask, the risk would be very low.
China is now experiencing an unprecedented surge in infections after abruptly lifting restrictions that torpedoed the economy and sparked nationwide protests. Hospitals and crematoriums across the country have been overflowing with COVID patients and victims, while the NHC on Sunday announced it would stop publishing daily nationwide infection and death statistics. Now, that decision followed concerns that the country's wave of infections is not being accurately reflected in official statistics. Beijing has admitted the scale of the outbreak has become impossible to track following the end of mandatory mass testing. Meanwhile, China will scrap mandatory quarantines on arrival, further unwinding years of strict virus controls as the country battles a surge in cases. Reacting with joy and rushing to plan trips abroad. Let's hear these reactions.
一是来华人员在行前48小时进行核酸检测，结果阴性者可来华；二是不再对入境人员实施全员核酸检测，对健康申报正常且海关口岸常规检疫无异常者，可放行进入社会面。六是本着试点先行原则，有序恢复中国公民出境旅游。上述暂行措施将于北京时间2023年1月8日起实施。
不就是这个广大群众的心声吗？早一点放开。所以就是，因为它这个据我了解，这个病毒的这个传播性还是非常强，就是可能防也防不住。那早一点放开呢，让这个早一点进入这种群体免疫的模式，我觉得也不一定是个坏事啊。
因为今天应该是我阳康之后的快1个周吧， 我属于上海第一波那个放开之后阳的人，然后就觉得自己的身体状态还没有完全恢复，然后现在又变成一个全民在生病的一个状态，就还是希望大家都能快点好起来，然后生活快点恢复到以前的状态吧。
是还挺惊讶的，就是因为可能疫情逐渐放开之后，确实知道可能会有这么一天，但是就是宣布的时候还是觉得，哎呀，疫情可能终于结束了，然后终于可以，比如说可能3年之前的旅游计划终于可以实现这样。
Meanwhile, European and Asian stock markets advanced, but Wall Street wavered after China said it would end quarantines for overseas arrivals, spurring hopes for the revival of the world's second-largest economy. The latest easing will put an end to nearly 3 years of border controls on January 8, when Beijing downgrades COVID-19 to a Class B infectious disease. People in China have since gone rushing to search for overseas flights, with the reopening said to be a boon for the travel industry. China's benchmark Shanghai Index and the second index in Shenzhen both posted healthy gains, while Tokyo ended a shade higher, with Seoul, Singapore, and Mumbai also up. Paris and Frankfurt also closed higher, but Wall Street mostly fell in the first session after a long holiday weekend. The Dow Jones Industrial Average eked out a small gain, but the tech-rich Nasdaq slid 1.4%. Meanwhile, the Department of Health officer in charge, Undersecretary Maria Rosario Vergere, confirmed that the Food and Drug Administration, or FDA, has already granted emergency use authorization for Moderna and Pfizer's bivalent COVID-19 vaccines. Reports said the current surge in COVID infections in China is believed to be driven by the BF.7 subvariant of Omicron. Let's listen in.
As to the evasiveness of the BF.7, sinabi naman talaga yun sa evidence na ito ay mas immune evasive kesa dun sa mga naunang subvariants nitong Omicron na to. Etong BF.7 hanggang sa ngayon, pinag-aaralan pa rin ng WHO, kaya hindi pa siya kinaklasify as a variant of concern or variant under monitoring, because they still need to do further studies in order for them to really determine kung ano yung characteristics ng variant na to. Ang masasabi lang ngayon ng mga artikulong lumalabas na sinasabi mas transmissible, mas immune evasive. Bivalent vaccine specific kasi siya, yung original natin na monovalent vaccine, yung ginagamit natin ngayon, was based on the original strain of the virus. This bivalent vaccine has that component which addresses Omicron and its subvariants. But syempre, nag-i-evolve pa rin yung pag-aaral ng ating mga scientists ukol dito. What we can tell you would be we are pursuing the procurement of these bivalent vaccines because articles and evidences have shown na ito ay mas makakaprotekta sa ating mga kababayan because of its component on Omicron variant. So, kaya kaya lang kasi yung bivalent, may specific siya na sa variant, yung mga BQ.1, yung mga ganon. So yan titignan natin, at titignan din natin of course ang real world effectiveness nito kapag ka nagamit na ng mas pangmalawakan. It's not supposed to be a concern, but it's supposed to be something that we be cautious on, something that we become more vigilant, because ito pong mga variants na to, hindi to matatapos because we are living with the virus already. The virus is here to stay. Expectedly, this virus will mutate dahil ito ay kaparte ng life cycle niya.
In another development, the United States is considering COVID entry restrictions for travelers from China after Beijing dramatically loosened hardline containment measures this month. There are mounting concerns in the international community on the ongoing COVID-19 surges in China and the lack of transparent data, including viral genomic sequence data being reported from the PRC, according to U.S. officials referring to the People's Republic of China. Beijing authorities have acknowledged the outbreak is impossible to track and have done away with much maligned case tallies, in addition to narrowing the criteria by which COVID fatalities are counted. But it is the lack of genomic data that has sparked particular concern abroad, U.S. officials said, making it increasingly difficult for public health officials to ensure that they will be able to identify any potential new variants and take prompt measures to reduce the spread. U.S. officials expressed concern at the potential for new variants to be unleashed, and that potential became even more real Monday when Beijing said it would scrap mandatory COVID quarantine for overseas arrivals from January 8, prompting many in China to push to plan trips abroad. Meanwhile, the Department of Health has recommended an extension of the COVID-19 state of calamity in the country. According to DOH officer in charge, Maria Rosario Vergere, this was contained in a memorandum submitted to the Office of the President. The current state of calamity due to COVID-19 is set to expire on the 31st of December. Let's listen in.
So yes, we already submitted our memo for the President requesting the extension of the state of calamity in consideration of the fact that the CDC bill was not enacted on time. Now, what would be the implications if the state of calamity would not be extended? We will be losing the different response strategies that we are doing right now. Because first, yung ating COVID-19 vaccination program is anchored on the state of calamity provision of the law. Kaya kapag nawala yun, baka mahirapan tayo magpatupad ng pagbabakuna natin ng COVID-19. Yung Emergency Use Authority na binibigay natin sa ating mga bakuna, pati sa mga gamot na ginagamit natin ngayon for COVID-19, we will also have issues on that. Also, yung ating mga indemnification at saka immunity from liability na nakasaad sa batas ay baka mahirapan din tayo. And aside from that, yung emergency hiring, emergency allowance ng healthcare workers natin, kasama rin dyan.
Now, as we heard there, Dr. Vergere said the current recommendation was in consideration of the fact that the CDC bill was not enacted on time. Now, she was referring to a measure that proposed the creation of the country's own Center for Disease Prevention and Control. Dr. Vergere said the DOH was just awaiting the response to the memorandum. The death toll from floods in the Philippines has risen to 25, according to officials, with storms expected to dump more rain over the hardest hit southern and central regions. Take a look. At least 13 people died, most from drowning in the province of Misamis Occidental on the southern island of Mindanao, according to the National Disaster Agency. In updating the toll, 26 people were still missing, 9 have been injured. Now, Pagasa said moderate to heavy rains were still likely across southern and central regions today and Thursday due to a low-pressure area off the coast that could develop into a tropical depression. The disaster agency said relief efforts were underway to help people in areas hit hard by the flooding, as more than 81,000 people sheltered in evacuation centers. The Philippines is ranked among the most vulnerable nations to the impacts of climate change, and scientists have warned that storms are becoming more powerful as the world gets warmer. Meanwhile, the monster storm that killed dozens in the U.S. over the Christmas weekend continues to inflict misery on New York State. Let's listen in.
It was a lot of snow, man. Cars were stuck. People were still trying to drive in that stuff, man. It was crazy, dude.
I was at work when it started. And then I was stuck there. I was stuck there for over 40 hours. Too many people were driving. Too many people were not listening to the band. You know, so the cars were blocking all the roads, made it a lot harder to get home.
I've been in Buffalo since 1970, February 5th, 1970. I immigrated here from Romania, and this is the worst thing I've seen in Buffalo, New York since I've been here. Well, the snow has been here for like 36 hours, but you know what? It's okay. It could be worse.
Now, the number of deaths attributed to the winter storm rose to more than 50 after officials confirmed 3 more fatalities in western New York's Erie County, the epicenter of the crisis. The winter weather is not over with Buffalo, New York, from what has become the deadliest storm in that area in at least 2 generations. Kathy Hochul, New York State's governor and a Buffalo native, described the storm aftermath as resembling a war zone. We're also learning now today that more than 30 people have been killed because of the storm in these last few days in New York. Blizzard conditions, howling winds, and sub-zero temperatures forced the cancellation of almost 20,000 U.S. flights in recent days. 37 straight hours is what they saw in Buffalo, the longest blizzard condition situation on record since 1950. Catastrophic floods, crop wilting, droughts, and record heat waves this year have shown that climate change warnings are increasingly becoming reality, and this is just the beginning, according to experts, as international efforts to cut planet heating emissions founder. Now, United Nations Chief Antonio Guterres warned world leaders at a climate summit in Egypt in November that humanity faces a stark choice between working together in the battle against global warming or collective suicide. Let's listen in.
Et on sait que ces vagues de chaleur se multiplient. On sait aussi que nos modèles sous-estiment la croissance de ces vagues de chaleur. L'augmentation d'intensité de ces vagues de chaleur, en particulier en Europe.
The clock is ticking. We are in the fight of our lives and we are losing. Greenhouse gas emissions keep growing. Global temperatures keep rising. And our planet is fast approaching tipping points that will make climate chaos irreversible. We are on a highway to climate hell, with our foot still on the accelerator.
Now, climate scientist Robert Votard said the year 2022 will be one of the hottest years on Earth, with all the phenomena that go with higher temperatures. Unfortunately, he said this is just the beginning. This year is on track to be the 5th or 6th warmest ever recorded, despite the impact since 2020 of a La Niña, a periodic and naturally occurring phenomenon in the Pacific that cools the atmosphere. When this phenomenon reverses, potentially within months, Mr. Votard said the world will likely climb to a new level in warming. In other news, a top Thai conservation official was arrested on corruption charges, with police saying he was caught receiving a bribe and that $144,000 in cash was found in his office. Take a look. Ruchada Suryakol na Ayutya, Director General of the Department of National Parks, Wildlife and Plant Conservation, was appointed in February. He managed efforts to protect the kingdom's environment and endangered animals, overseeing more than 150 national parks. Now, police said the officials have arrested him while the money was exchanged, so the evidence was quite clear. Police searched Ruchada's office in the capital, Bangkok, after he was detained, and they found roughly 5 million baht or $144,000 in cash. Ruchada has denied all the charges. According to the Bangkok Post, a civil service fact-finding committee had been set up to look into the bribe-taking allegation and would give its findings in 7 days. Now, underneath the calm turquoise waters of eastern Thailand, a rapidly spreading disease is killing corals over vast stretches of the seafloor. And scientists fear it may be getting worse because of climate change. Take a look.
แต่โรคปะการังแถบสีเหลืองตอนนี้เราพบว่าเมื่อปะการังเป็นโรคแถบสีเหลืองแล้วเนี่ยไม่มีการฟื้นตัวจะค่อยๆตายไปจนตายทั้งโคโลนีเพราะฉะนั้นการสร้างความเสียหายเนี่ยโอกาสสร้างความเสียหายเป็นแล้วตายเนี่ยก็คือปะการังที่เป็นโรคแต่
wrong but the yellow one I think people don't really recognize because many people thought it's a color of coral so no one recognize the disease after we introduce people this is a disease and many people came to us like inform us more and more and then we check it they are everywhere.
Now, yellow band disease, named for the color it turns corals before destroying them, was first spotted decades ago and has caused widespread damage to reefs in the Caribbean. And there is no known cure. On one research trip near Samaisen Island in Chonburi District, Dr. Lalita and her team donned diving gear on a boat before heading underwater. And they photographed infected corals, taking measurements and photographs while harvesting samples to study later. Now, Thai marine authorities are using social media to track reports of infected reefs and have also asked the public to report any sightings of affected corals. Ms. Lalita Puchim of Thailand's Department of Marine and Coastal Resources also said the loss of corals would have a devastating impact on the ecosystem. The reef is like a forest, she said, sustaining massive amounts of life, and its death could eventually impact humans too. Scientists are hoping their investigation into this outbreak will help find a way to stop or cure yellow band disease. As my usual habit, I'd like to end the day on a positive note. Let's encourage and build each other up so that no one is left behind. And thank you for watching ASEAN in Focus. I'm Alma Angeles, reminding you to stay in the news because we live in extraordinary times. Good night.